Ever get that nagging feeling something's off? Sometimes those small, annoying symptoms are your body's way of sending a big message. We're all busy, and it's easy to brush things off. Tiredness, weight loss, little changes. But what if those are signs you shouldn't ignore? Today, we'll break down 8 crucial signals your body uses to warn you about serious health issues. This isn't about panic, it's about being your own best health advocate. Let's learn to listen, take action, and get smart about our health. Ready? Let's dive in. First up, unexplained weight loss. This is one of those symptoms that can easily slip under the radar, especially in a world where so many people are trying to lose weight on purpose. But when the pounds start dropping and you haven't made any changes to your diet, exercise, or daily routine, it's time to pay attention. Unintentional weight loss is your body's way of waving a red flag, signaling that something deeper could be going on beneath the surface. Losing weight without trying might sound great, especially if you've ever struggled to shed a few pounds. It can feel like a dream come true, until you realize you haven't done anything differently. No new workout plan, no change in what you eat, and yet, the numbers on the scale keep dropping. It's easy to brush it off as a lucky break, but unexplained weight loss is rarely just good fortune. If you haven't changed your diet or activity, it's a red flag. Your body is designed to maintain a certain balance, and when that balance is disrupted without a clear reason, it's often a sign that something is off. Maybe you're eating the same meals, following the same routines, but your body is reacting as if you're burning more calories than usual. This isn't just about numbers, it's about your health. Your body could be burning extra energy because something's wrong inside. This kind of weight loss, 10 pounds or more, or over 5% of your body weight in 6 to 12 months, can be an early sign of cancers like pancreatic, stomach, esophageal, or lung. But it's not just cancer. Other serious conditions like thyroid disorders, diabetes, chronic infections, or even digestive diseases can also cause your body to lose weight unexpectedly. Sometimes the weight loss is gradual, sneaking up on you over months. Other times it's more sudden, and you notice your clothes fitting differently almost overnight. It's not about normal fluctuations or a new workout routine. If your clothes are getting looser and you can't explain why, don't just celebrate. Check in with your doctor. Weight can naturally go up and down a little, but when you're consistently losing weight without trying, it's time to take notice. Maybe your favorite jeans suddenly feel baggy, or you're tightening your belt another notch. These are subtle clues that your body is changing in ways you didn't intend, especially if it comes with other symptoms like loss of appetite or feeling full quickly. Sometimes unexplained weight loss is accompanied by a lack of interest in food, or you might find yourself getting full after just a few bites. Maybe you're skipping meals without realizing it, or you're just not as hungry as you used to be. These changes can be easy to ignore, but they're important signals. Other symptoms to watch for include fatigue, weakness, or digestive issues like nausea or diarrhea. Your body is a complex machine. When something's off, it often shows in more than one way. Think of yourself as a detective. Unexplained weight loss is a major clue. It doesn't mean the worst, but it does mean you need an expert's opinion. Start by tracking your weight regularly, jotting down any changes in your appetite, energy, or overall health. Look for patterns. Are you losing weight steadily over weeks or months? Are there other symptoms that seem to go along with it? The more information you have, the easier it will be for your doctor to help you figure out what's going on. Ignoring it is like ignoring a smoke alarm. You wouldn't ignore a beeping smoke detector in your home, and you shouldn't ignore unexplained changes in your body either. Know your normal, what your weight usually is, how your clothes fit, how you feel day to day. Track changes even if they seem small. If the pounds drop for no reason, make that appointment. Early detection can make a huge difference, whether it's catching a serious illness early or simply getting peace of mind. Be proactive, not reactive. This is your health, don't leave it to chance. Taking action now, even if it feels unnecessary, is always better than waiting until things get worse. Remember, unexplained weight loss is your body's way of asking for help. Listen to it, trust your instincts, and reach out to a healthcare professional. Your future self will thank you for paying attention today. Let's talk about fatigue, not just the kind of tiredness you feel after a long day, but a deep, overwhelming exhaustion that seems to seep into your bones and refuses to let go, no matter how much you rest. This isn't the sort of tiredness that a good night's sleep or a strong cup of coffee can fix. It's a relentless, crushing fatigue that can make even the simplest tasks feel like climbing a mountain. This isn't just end-of-the-week tiredness or the exhaustion you feel after a busy day at work. It's a constant, bone-deep weariness that lingers for weeks or even months. Everyday activities like showering, making breakfast, or walking to the mailbox can suddenly feel impossible. You might find yourself struggling to get out of bed in the morning, feeling overwhelmed by tasks that used to be routine, or simply lacking the energy to engage with friends and family. What causes this kind of fatigue? In some cases, cancer cells can drain your body's energy reserves and trigger inflammation, leading to this relentless exhaustion. Your body is fighting a hidden battle, and the energy you once had is being diverted to fight off disease. This isn't just about feeling sleepy, it's about your body being physically unable to recharge no matter how much you rest. Many people try to push through, blaming their fatigue on stress, long hours, or a busy lifestyle. It's easy to dismiss this kind of tiredness as just part of modern life. But when fatigue is persistent, unexplained, and doesn't improve with rest, it's a major warning sign that something more serious could be going on beneath the surface. If you wake up feeling just as exhausted as when you went to bed, struggle with simple activities like climbing stairs or carrying groceries, or feel weak and drained for weeks at a time, it's time to listen to your body. This isn't laziness or lack of motivation, it's your body sending you a message that something isn't right. This kind of fatigue doesn't go away with rest, and it can be one of the earliest symptoms of certain cancers, such as leukemia, colon cancer, or stomach cancer. It's not just about being tired, it's about a fundamental change in your body's ability to recover and function. You might notice that you're sleeping more but feeling worse, or that naps and downtime don't help at all. Don't dismiss this kind of fatigue as just part of getting older or being busy. It's easy to ignore or rationalize, but your body is trying to tell you something important. Ignoring these signals can delay diagnosis and treatment of serious conditions. If your energy levels have changed dramatically and it's affecting your work, relationships, or ability to enjoy life, don't wait, see a doctor. Be honest about your symptoms, even if they seem vague or hard to describe. Your healthcare provider can help determine if there's an underlying cause that needs attention. Remember, normal tiredness fades with rest and time. Cancer-related fatigue lingers, grows, and can take over your life if left unchecked. It's not something you can simply power through or ignore. Take this kind of fatigue seriously. Listen to your body, trust your instincts, and get checked. Early detection can make all the difference, so don't wait. Your health is worth it. Headaches, fever, and vomiting are symptoms that almost everyone experiences at some point. They're common, and often they're nothing to worry about. Maybe you're fighting off a cold, feeling stressed, or ate something that didn't agree with you. But when these symptoms become persistent, severe, or start to feel different from your usual experience, it's important to pay close attention. Your body could be trying to tell you something more serious is going on. Ask yourself, are your headaches suddenly more severe than before? Do they feel different in quality or location? Are they waking you up in the middle of the night? Or are you finding it hard to get back to sleep because of the pain? Headaches that disrupt your sleep or are accompanied by other symptoms like vision changes, confusion, or weakness should never be ignored. Similarly, a low-grade fever that lingers for days or even weeks without a clear explanation can be a warning sign. Most fevers come and go with infections, but if you notice your temperature is slightly elevated day after day, or you're sweating at night for no obvious reason, it's time to take note. Chronic fevers can sometimes be the body's way of signaling an underlying issue that needs medical attention. Vomiting is another symptom that's easy to brush off, especially if you think it's just a stomach bug or food poisoning. But if you're vomiting repeatedly, especially without a clear cause, or if it's happening alongside headaches or fever, it's important to consider that something more serious could be at play. Persistent nausea and vomiting can lead to dehydration and other complications, so don't ignore it if it keeps coming back. Persistent headaches, especially those that are new or different, could be a sign of something serious like a brain tumor. Unexplained fevers that don't go away may point to blood cancers such as leukemia or lymphoma. These conditions are rare, but early detection can make a huge difference in outcomes. That's why it's so important to notice when your symptoms don't fit the usual pattern. Ongoing vomiting, especially when paired with abdominal pain or weight loss, can sometimes be linked to cancers of the brain or abdomen. While these are not the most common causes, they are important to rule out, especially if you have other risk factors or a family history of cancer. Don't hesitate to bring up these concerns with your healthcare provider. The key word here is unexplained. If you can't find a clear reason for your symptoms, like a recent illness, new medication, or obvious stress, and they keep happening, that's a red flag. Don't dismiss your concerns just because the symptoms seem mild or come and go. Trust your instincts if something feels off. One of the best things you can do is keep a simple symptom journal. Write down when your symptoms start, how long they last, how severe they are, and anything that seems to trigger or relieve them. You can use a notebook, a calendar, or even a health tracking app on your phone. This record will help you spot patterns and give your doctor valuable information. When you see your doctor, details matter. Instead of saying, "I get headaches," try to be specific. "I've had a headache every morning for 2 weeks and it wakes me up at 3 a.m. The more precise you can be, the easier it is for your doctor to figure out what's going on and decide what tests or treatments you might need. Remember, one-off symptoms are usually nothing to worry about. Everyone gets the occasional headache, fever, or upset stomach, but if you notice a pattern, symptoms that are persistent, unusual, or getting worse, it's time to take a closer look and reach out for help. So, listen to your body, log your symptoms, and talk to a healthcare professional if you're concerned. Early action can make all the difference when it comes to your health. Your skin is your body's largest, most visible organ and a powerful health barometer. Changes in skin color, texture, or new growths can be early warning signs of cancer, not just skin cancer. Watch for darkening, yellowing, jaundice, redness, itching, or unusual hair growth, but the big one's skin cancer. Know your moles and spots. Use the ABCDEs of melanoma: asymmetry, border irregularity, color changes, diameter over 6 mm, and evolving shape or size. Also, look for new growths, sores that don't heal, or bumps that bleed or scab repeatedly. Do a monthly head-to-toe skin check, including hard-to-see places. If you spot anything new, changing, or just odd, don't wait. See a dermatologist. Your skin is always sending signals. Pay attention and act early. Unusual bleeding or discharge is a symptom you should never ignore. Any bleeding from places that don't normally bleed or at unusual times is a warning sign. Examples: coughing up blood, possible lung cancer; blood in stool, colorectal cancer; postmenopausal or between-period bleeding, gynecological cancers; blood in urine, bladder or kidney cancer; or nipple discharge, breast cancer. Persistent unusual discharge, watery, foul-smelling, or bloody can also signal trouble. It's not about a one-time event but ongoing or unexplained changes. Many benign conditions can cause these symptoms, but you won't know until you get checked. Early detection is key. Don't let embarrassment or fear delay you. If you see blood where it shouldn't be, treat it like a flashing warning light. Make the call, see your doctor, and take control of your health. Pain is your body's alarm system, but persistent unexplained pain is a sign you shouldn't ignore. We all get aches from time to time, but pain that lingers for weeks without a clear cause needs attention. Deep aching pain in bones, a dull ache in the back or abdomen, or a new persistent headache can all be early signs of cancer. It's easy to rationalize pain, blaming age, stress, or minor injuries. But if it doesn't go away, it's time to act. Pay attention to the pain's characteristics. Is it constant, sharp, dull, worse at night, or interfering with sleep? The more details you can give your doctor, the better. Don't just mask the pain with medication. Find out what's causing it. If pain becomes your long-term companion, get it checked. Finding a new lump or swelling is one of the most recognized cancer warning signs. Lumps can appear anywhere: breast, testicle, neck, armpit, or other soft tissues. Not all lumps are cancerous, but any new or changing lump should be checked by a doctor. Cancerous lumps are often hard and fixed, but not always. Know your body. Regular self-exams are crucial. For women, monthly breast checks. For men, testicular checks. Swelling in lymph nodes, neck, armpit, groin, can signal lymphoma or other cancers. The key is persistence and growth. A lump that sticks around or gets bigger needs evaluation. Don't wait and see. Find a lump, get it checked. Early action makes a difference. Changes in bathroom habits can be awkward to discuss, but they're important warning signs. Persistent changes in bowel habits, constipation, diarrhea, or narrow stools, can signal colorectal cancer, especially if combined with blood in the stool or a feeling of incomplete emptying. Urinary changes, pain, frequency, urgency, or blood in urine, can point to prostate, bladder, or kidney cancer. Don't dismiss these as just aging or minor issues. If you notice ongoing changes, talk to your doctor. Your doctor has heard it all before. Clear, honest descriptions help them help you. Don't let embarrassment stop you from getting answers. Listen to your body and act on persistent changes. That's our rundown of 8 signs you shouldn't ignore. The goal isn't to scare you, but to empower you with knowledge and confidence. Your body is always communicating. Learn to listen before it has to shout. None of these signs mean cancer for sure, but they're reasons to talk to your doctor. Early detection saves lives. Be proactive, be persistent, and be your own best advocate. Stay healthy, and thanks for watching.